Good afternoon, Chairman of the panel. I appreciate this opportunity you've given me to make this presentation, and I don't take it for granted because I wasn't listed. Okay, I'm presenting on the prevalence of drug-resistant tuberculosis and HIV co-infection among internally displaced persons in Bakassi, Cross River State. So the aim of this study, okay, let me start by way of introduction. Tuberculosis is a chronic airborne infectious disease caused by the Bacillus mycobacterium tuberculosis. And it is ranked among the 10 highest or top causes of death globally. In fact, it is ranked second after COVID. It is one of the diseases that makes Nigeria to be ranked among the 30 high TB burden countries. And the situation is bad in Nigeria because of non-compliance and non-detection of cases. So the aim of this study is was to determine the prevalence of rifampicin resistant TB and HIV co-infection among the internally displaced persons. These are people who are returnees from Cameroon, and Bakassi local government area, as we know the history, was ceased to be part of Cameroon. So all those from Bakassi were now displaced, and so they have to create a place as an emergency situation for them in Ikan. So their situation, their living condition is likened to that of refugees because so many of them were returned and there was no place for them. So they have crowded living conditions that is not even, the social amenities are not available. And this situation makes room for disease spread in their living quarters. Okay, so the materials and methods, the study was a community-based cross-sectional study in Ikan, where we now know as Bakassi local government area. The subjects were HIV positive and HIV negative individuals aged between 15 years and above with active pulmonary TB symptoms and those on ART who gave consent. A total of 244 subjects were enrolled in the study. Ethical approval was obtained from the Cross River State Ministry of Health Research Ethics Committee. And before anything was collected from the subjects, informed consent was obtained. Questionnaires were also administered to obtain vital information on social demographic characteristics. Blood samples were collected from the patient. Sputum samples were also collected. Now for blood sample, the national HIV algorithm for Nigeria was used to test the samples. And then GeneXpert MTB reef assay was used for TB detection. Rifampicin resistance was also tested for after 2 months of administering the TB regimen. The study was for 6 months. At the first contact, the patients were administered TB drugs, and by month 2 of follow-up, samples were collected and tested for resistance for rifampicin. The statistical analysis, SPSS version 22 was used, and data presented with statistical significance set at 0.05. Now, the results, we have, the first one is a distribution of HIV by social demographic characteristics of subjects. marital status, age, occupation, educational level were all measured, and statistically, occupation and marital status seem to be significant. For TB also, age was the significant factor. And for the prevalence, can I have that chart? The prevalence of TB only was 17.6%. Prevalence of HIV only was 27.5%. And the co-infection prevalence was 7.4%. Now there were factors that were the factors that predisposed the subjects to TB, HIV, and the co-infection. The first one was apparent malnutrition, or the nutritional status. And we saw that malnutrition was a major factor because the subjects did not feed well, and so that ranked very high there, significant. Economic status too, because they came back with virtually nothing. They didn't have the means to live well. So economic status also ranked high. Then lifestyle, smoking, and all the alcohol use, and then overcrowding in their quarters. These were all factors that predisposed them to infection. So in conclusion, the results of this study recorded a high prevalence rate for TB, 17.6%, for HIV, 27.5%, and the prevalence for co-infection, TB and HIV, 7.4%. The study also recorded prevalence for rifampicin resistance at 0.41%. So that was heartwarming because it wasn't so high. And the age group that was most affected was 30 to 44 years age bracket. And the factors are malnutrition, alcohol use, crowded environments, poor economic status. These were the factors that predisposed subjects to infection. Also, non-compliance to TB treatment. The recommendations are there that the government needs to focus attention on this group of people because there's so much going on there and they are neglected. So they have to provide the social amenities for them to be able to curb this spread of HIV. These are two serious infections, and with that spreading, it could be a public health emergency. All right, those are the highlights that the prevalence of rifampicin resistant tuberculosis detected through gene expert among the study subjects was 0.41%. Thank you very much.
Thank you very much. Thank you very much.